President Biden now receiving treatment after testing positive for COVID. The president saying he is still working from the White House, though, and he's telling Americans he will be fine and not to worry. Chief Medical Correspondent Dr. Jen Ashton joining me now for more on this. Of course, he's telling us not to worry, Jen, right?
Yeah, Kara, I had to smile because it's like something we would say to one of our relatives, right?
Exactly. Don't worry. Everything's fine. Well, he is fully vaccinated. We talked about this yesterday when the news broke. You and I discussed all the good parts here. He's also boosted. He's in good health. But he is 79, right? And he's at higher risk for complications. Now, the White House says it's following protocols to protect other people from getting infected. So let's just talk about how important this decision is right now.
Well, first of all, remember, the White House is not like your house or my house, to state the obvious. There are a lot of people that need to be there. They need to work there. They need to be there not just for fluff, but not only to protect the president and care for the president, but to continue to perform the duties that go on every single day around the clock in the White House. So now it's about mitigating risk, protecting those people as much as possible. And as you've heard me say from the beginning of this pandemic, Kara, there's no such thing as zero risk. So likely their protocols involve increase in ventilation and distancing, minimizing the number of people that are coming into contact with the president, everyone wearing N95s, having the president masked if other people need to be in the room. These are common sense precautions that I would recommend to you if you had someone with COVID-19 in your house. It's just that this is a much bigger house.
Yeah, much bigger. And we also talked about this. The president was immediately given Paxlovid, which Pfizer says greatly reduces your risk of hospitalization. But if his symptoms were mild, do you think he really needed this antiviral to begin with?
Well, first of all, obviously, I'm not the president's physician. The president's physician obviously thought he needed it. And if the president were my patient, I absolutely would recommend Paxlovid for the patient. Let's go back to the FDA emergency use authorization for Paxlovid, which occurred at the end of December of last year. It was authorized for people at home with mild to moderate COVID-19 disease who were at high risk for developing complications of COVID-19. The president fits that criteria, definitely by age, but anyone, even younger people, if they have a risk factor that puts them at high risk for complications or serious COVID-19 illness like diabetes or obesity, absolutely they meet criteria, and in that case, the benefits far outweigh the risks.
Well, and we've talked also a lot about Paxlovid rebound. You take it and then you get COVID immediately after. Dr. Fauci experienced that. Our John Carl experienced that. I took Paxlovid. It helped me tremendously. My symptoms didn't get worse. So how often is this occurring? And, is this a concern for the president?
A lot of people are asking about that. I've also had patients question that for themselves when I've recommended Paxlovid. Based on published case reports, it's under 10%. It may be even 10%, let's say, but it's, hovers around 4, 5, 6% of cases. And what that refers to is patients take Paxlovid, their symptoms go away, they may even test negative for a few days, and then they get this rebound. Their symptoms come back, they test positive again. In some cases, their symptoms are worse. I want to be crystal clear. That is unpleasant. It's an inconvenience. But remember the goal of this drug. It's to keep people out of the ICU, out of the hospital, ideally, and to save lives. So when you talk about risk versus risk, the risk of Paxlovid, if you put it at less than 10% of a rebound phenomenon and the inconvenience, the benefits, survival, far outweigh that risk.
Point well made. Dr. Jen Ashton, have a fabulous weekend.
Thanks, Carrie. You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.